I call the member for Macarthur.
Thank you, Madam Deputy Speaker. Today now marks the third time that this government has tried to launch its disgraceful attack on the forgotten families of Macarthur, families who are already doing it tough in these difficult times. This government is shamefully out of touch with the Australian people and Australian values. The very existence of this bill represents yet another broken promise from Labor. Labor promised hand on heart they would not touch the private health insurance rebate. I must be having deja vu because I can vividly recollect a promise to Andrew Wilkie about poker machine reforms, a promise to the Australian people to return a budget to surplus, and a promise that there will be no carbon tax under the government I lead, to borrow a phrase from the Prime Minister. Time after time, all we are seeing are repeated betrayals on the people of Australia. This government, this Labor Greens alliance, will say anything to be in government, but once in government turn their backs on the people who elected them. They say one thing, but yet do another. This government has a trust and credibility problem with the people of Australia. This bill represents yet another botched and broken election promise that will, without a doubt, result in greater cost of living pressures on families across this nation. The Fairer Private Health Insurance Incentives Bill 2011, the Fairer Private Health Insurance Incentives Medicare Levy Surcharge Bill 2011, and the Fairer Private Health Insurance Incentives Medicare Levy Surcharge Fringe Benefits Bill 2011 are a key part of a Prime Minister's ideological arsenal against the freedom of choice in healthcare. Private health insurance gives people this choice of their treating doctor, choice of when and where they can access health services, choice of surgery options, and choice to be treated in a private hospital. Private health insurance does not take away from the public health system, but instead adds significant value to Australia's total healthcare resources. The private health insurance rebate is a policy that has been staunchly defended by the Coalition because it is, simply put, a good policy. The 30% rebate has had a direct result in taking pressure off the public health system, all the while adding value to the health system as a whole. Australia's public health system is highly regarded and does a fantastic job with the resources at its disposal. I am confident that under the leadership of a Liberal New South Wales Government under Premier Barry O'Farrell, that the New South Wales public health system will see many positive developments over the coming years. It is not feasible to say that the public health system in Australia could survive without the complementary benefits that the private health system provides. This bill is a shameless, cost-shifting measure from the Commonwealth to the state's public systems. When the 30% private health insurance rebate was introduced by the Howard Government, the national coverage of private health insurance rose from 34% to 44%. The Howard Government had the foresight to also introduce the Medicare Levy Surcharge for those who should be able to afford private health insurance, but for whatever reasons had not taken it up. This measure ensured that those who chose not to contribute to their own healthcare through the private healthcare system will still contribute to the public healthcare system. The test used to determine whether a person would be liable to pay a Medicare levy surcharge would include taxable income, reportable fringe benefits, reportable superannuation contributions and total net investment losses. Now, this government is trying to distort these provisions and is seeking to apply the same income test to determine whether families will also lose their rebate. It is a perversion of what the Medicare levy surcharge sought to achieve. This test will not be used for people who opt out of eligible private health insurance, but will apply for people who are currently paying their premiums and benefiting from the 30% rebate. These people will lose out. Some will be pushed into a lesser category of rebate, and some will lose their rebate altogether. All Australians will face higher premiums because of this disgraceful government's actions. The private health insurance rebate gave families in Macarthur the incentive to provide their own healthcare needs and get little back from the governments for doing so. This support in the form of a 30% rebate on eligible private health insurance policies contributes back into the health system many times over through private health insurance premiums. For a couple in their mid-30s with 2 children, basic hospital and extra covers will cost at least $3,000 a year without the rebate. If people are going to be socially responsible and put their discretionary income towards their own healthcare costs, why should we punish them? Their investment in their health and in turn into the private health system contributes to the resources that are available in both the public and private health systems. If this government decides to take away the incentive for people to purchase private health insurance, we risk losing the entire premium and in turn create added pressure on the public system. This ideological attack on private health insurance may represent a short-term saving, but the longer-term implications on families are far-reaching. The immediate financial impacts of this bill will not just be felt by 2.4 million on higher incomes, who will face immediate increases of their premiums of 14%, 29%, 43%. All Australians with private health insurance will face higher premiums in the future if these changes proceed. Deloitte have predicted that private health insurance premiums will rise 10% above what they otherwise would be. In addition, Deloitte's analysis of the proposed changes show in the first year 175,000 people would be expected to drop their private hospital cover, and a further 583,000 are expected to downgrade their cover. Over 5 years, Deloitte's modelling forecasts that 1.6 million will drop their cover and 4.3 million will downgrade. This is in stark contrast to the Minister's figures of only 27,000 to drop their cover. Indeed, the government-owned insurer Medibank Private has predicted that 37,000 of their members alone will drop their cover and 92,500 will downgrade. How did the Minister get it so wrong? This is yet another example of a government's botched attempts at health reform and lack of thorough planning in policy making. It is a case of this Prime Minister and Labor yet again meddling with a good policy that works, a policy that delivers, and a policy that provides quality health care to Australian families. This bill is already bearing the hallmarks of the Malaysia solution all over again. With each person either dropping or downgrading their cover, there is a flow-on effect of a net reduction of resources within the private healthcare system. Each policy downgrade will place greater pressure on the public health system, all the while punishing those who continue in the private health system. The government has not even bothered to disclose the numbers of people expected to downgrade their private health insurance coverage. It is reasonable to expect that many people will seek a cheaper product with fewer procedures covered, which will have second-round effect for public hospitals. This represents $3.8 billion in additional recurrent costs for the public sector. In Macarthur, 63,828 people are covered by some form of private health insurance, representing 47.8% of the voters. Suffice to say, this legislation will affect close to half of my electorate. At the 2007 election, the government promised, hand on heart, that they would not touch a private health insurance rebate. However, soon after elected, they tried to push through this legislation, not once, but twice. The Senate soundly rejected it. Now the Prime Minister is relying on her good graces with the Greens to push this bill through and once again betray the trust of families in Macarthur and Australia-wide. I guess it must get easier the more you do it. The government has no foot to stand on when they say they will deliver on a promise. Just look at their track record. They've bungled every program and policy they've laid their hands on. Now this government is attempting to undermine both the public and private health systems simultaneously. This legislation is nothing more than a noxious housewarming gift for a newly elected New South Wales government, who have a monumental task of fixing up more than 15 years of total and utter neglect of the public health system under Labor. Allied health services are also expected to bear the brunt of this government's attack on private health insurance. It is expected that 2.8 million people with a general treatment cover are expected to withdraw and 5.7 million to downgrade over 5 years. This means fewer people accessing allied health services, which means less income and fewer jobs. Families in Macarthur are already financially stretched to the limit. Many pensioners are at the point where they had to give up their private health insurance after a recent rise in premiums and at a time of life when they cannot afford to lose it. The government's proposed changes are just going to make a bad situation worse. The Coalition has strongly supported giving Australians the choice of affordable private health insurance. The 30% rebate on private health insurance premiums is a proven policy that we have seen works. Families in Macarthur are going to be negatively impacted by this legislation, and many will have no option but to forgo on private health insurance and rely on the already stretched public system. This is a bad policy that will do nothing but harm both our public and private health systems, and I would urge members of the House to keep faith with their electorates and reject it. So I say this to members opposite: stand up for affordable and accessible private health cover. Stand up for your community, your seniors and your youth. Stand up for a fair go for Aussie families. Stick to the ironclad guarantee that the Prime Minister previously made to the Australian public. Under no circumstances will we touch the private health insurance rebate. And as late as August 2010, the Prime Minister also stated Medicare rebates are safe under Labor. Well, how safe? These bills change all that. And no wonder there's a trust and credibility problem with this government. Thank you, Madam Deputy Speaker.